It's the appointed time. We have a quorum. I call to order the meeting of the Finance Committee. The designated time of today's meeting is 5:30 p.m. If necessary, I will extend the meeting by 15 minutes. Please note that starting from today, on a pilot basis, the Secretariat will provide real-time subtitles for Finance Committee meetings. Members and members of the public may watch the Finance Committee meeting with real-time subtitles via webcast or other channels. Now, I remember members that in accordance with Rule 83A of the Rules of Procedure, members should disclose the nature of any direct or indirect pecuniary interest relating to the items under discussion at the meeting before they speak on the items. I also draw members' attention to Rule 84 on voting in case of direct pecuniary interest. I need to declare an interest here for the two public works projects to be considered at today's meeting. I am an advisor for Bank of China, Hong Kong. The first agenda item is FCR 2025-2642. This item seeks approval of the recommendation of the Public Works Subcommittee made at its meeting held on 2nd of July 2025 in relation to the proposal in PWSC 2025-2613, 69 EG construction of a clinical training immunity center at number 6 Sassoon Road, the University of Hong Kong main works. To upgrade the project to Category A in money of the day prices, the estimated cost is $1.0249 billion in accordance with paragraph 3A of the Finance Committee procedure. Because the Public Works Subcommittee does not recommend further discussion of the item by the committee, nor is there a request strongly made by not less than 3 committee members to further discuss the item, no further discussion is to be conducted by the committee. I now put FCR 2025-2642 to vote. Members in favor, please raise your hands. Thank you. Members against, please raise your hands. None. I believe all of members who voted on the item are in favor of the item. Declare the item approved. Let's move on to the second agenda item for the day, FCR 2025-2643. This item seeks approval of the recommendation of the Public Works Subcommittee made at its meeting held on 2nd of July 2025 in relation to a proposal in PWSC 2025-2614, 200 EK Joint User Complex at Chengsha Wan Road, Shenzhou Po, to upgrade the project to Category A in money for the day prices. The estimated cost is $2.891 billion. In accordance with paragraph 3A of the Finance Committee procedure, because this Public Works Subcommittee recommends further discussion of the item by the committee, nor is there a request strongly made by not less than 3 committee members to overturn the recommendation, we are to further discuss the item today as recommended by the subcommittee. We also have the relevant government officials attending today's meeting. We had the Public Works Subcommittee scrutinizing the item for about 56 minutes. The administration has submitted a supplementary paper after that meeting. We have in attendance today Mr. Gary Poon, the Deputy Secretary for Development, Planning and Lands. We also have government officials from other departments, including the Government Property Agency, Architectural Services Department, Social Welfare Department, LCSC, Health Bureau, Hospital Authority, and the URA. Let me read out the order in which members are going to speak. Dr. Johnny Dr. Tan Yueheng, Mr. Lai Man-kwong, Mr. Chen Siu-hong, Mr. Vincent Ching, Mr. Chen Yong, Dr. Chen Han-pen, Mr. Chen Kim-po, Ms. Chen Ho-yen, Mr. Eric Yim, Dr. So Cheng-wing. I'll assign a 5-minute time limit. Dr. Johnny I support this proposal because it will provide diversified facilities for Shenzhou Po. But it would cost approximately $3 billion. It is a significant sum, so I want to ask more about the details. I want to ask about paragraph 24, item K. So it says the relevant cost would be $44 million. So that is for the social welfare facilities. Why is it such a high cost? $144.8 million. And the last page of the paper, we have talked about some items for the Health Bureau. We have the smart toilet system costing $1.7 million. And we have seen recently some government smart toilet projects going over budget. We had one that should only be $8 million. It ended up costing $13 million. So for this $1.7 million, how many people are to be served by the toilets? And is the cost really adequate? Why did we go over budget before for other government projects? Thank you. Mr. Poon, Gary Poon. I will let the other department representatives answer the respective questions for the Social Welfare Department and Health Bureau. But let me say this, the construction floor area is 45,000 odd square meters, 17 stories. So we have quite a large floor area to cover in this project. I will let the Social Welfare Department and Health Bureau representatives answer the relevant questions. Who is going to answer the question about Social Welfare Department? Mr. Alan Young, right? Mr. Alan Young, please. So we have the cost of about $144 million for facilities. The cost reserved for the fitting out works, SWD's premises. That would cover costs for engaging professionals to design the facilities as well as the building services and building works. We have referred to past costs for other projects that have similar facilities. We would have facilities such as childcare center and elderly facilities. We need to do some fitting out works in the premises. We need to do E&M works. And for the child care center in particular, we need to implement some safety measures, such as putting in place safety mats. Mr. Ellen Young, the member asked you specifically about the Social Welfare Department premises. The area. Can I provide the details later? I'll let the other department representative speak first. Health Bureau, who is going to answer the question? Director, Development and Works Hospital Authority, Mr. Kevin Lowe. Chair. Yes. For the $1.7 million, the figure for a smart toilet system. It is for the facilities that can detect and respond to abnormal situation in toilets, such as accidental fall of patients or visitors or prolonged inactivity in the toilets. In a story, we would have approximately 5 public toilets. That's how we derive the figure. We believe this cost is reasonable and adequate. Dr. Any further questions? I want to ask, when you talk about 5 public toilets, how many toilet stalls are there specifically? And I think this cost is for the hardware. How much does the software cost? We do not have the figures just yet. We will only have the specific figures after tendering. I think you already have some sort of estimates. Mr. Kevin Lowe, can you provide the specific figures after the meeting then? It's the same for Mr. Alan Young regarding the details of the Social Welfare Department premises. Let me add something. The approximate area for Social Welfare Department and Health facilities, it would occupy 1/3 of the construction floor area, and the construction floor area specifically would be about 6,000 square meters. The 6,000 odd square meters operational area for SWD facilities is for the hostels for the mentally handicapped and other centers for intellectually disabled persons. So we will need more safeguards and facilities that are different from ordinary office facilities. Thank you. Next, Dr. Tan Yueheng. Thank you. I have two questions. One in relation to the DHC and Community Health Center. So I want to ask, right now we have a DHC and a Community Health Center planned. These belong to different departments, but to the public it may sound like their functions will overlap. So I want to ask, is there some kind of sharing of facilities to lower the cost? So I also want to ask about how we have some government offices in the facility as well for the LCSC and other departments. But then the joint user complex is mainly about improving the neighborhood to provide more facilities for citizens. We should have more floor area specifically for citizens. So can we lower the office area so that we have more space for public facilities? Thank you. Mr. Gary Poon. Thank you, member, for your questions. For the Community Health Center and the District Health Center, they occupy different spaces in the building. The District Health Center will occupy 1-story, 7th floor. The Community Health Center will occupy the 8th to the 12th floor. The DHC is to provide disease prevention services, so it only occupies 1 story. But the Community Health Center of the Hospital Authority will provide primary health care services. The more serious conditions, those with the more serious conditions would have to go to the hospital, but then this Community Health Center will help by providing some basic services on a community level. So these two facilities are actually complementing each other. Dr. Tan also asked about government office space. For the net operating floor area, not much of it is office space for government departments such as the LCSC. We have these departments operating in other premises in the district. Now we want to relocate the other offices to the joint user complex so that their offices are closer to the department's facilities. As you can imagine, if you have the LCSC office close to recreational facilities of the LCSC, operations will be smoother. It is a reasonable arrangement. I also want to say that when these facilities are moved into the joint user complex, some of the original office space can be vacated and the departments can have more space for the provision of other services. So this is my reply. Excuse me, but Dr. Tan talked about specifically for the joint user complex. Is there any room for compressing the office floor area? We do note the allocation of floor space at the moment, and you can see in the enclosures what is planned on each story. And you can refer to those. There is actually not much space for government offices. They are mainly healthcare, recreational, and social welfare facilities. We will see, however, whether we can compress office space because we do want to provide more facilities for citizens. But then there please understand there is a need to relocate the offices here. Say the LCSC office has a need to relocate their office in other premises in the district to the building. We are also to reprovision the Chen Shaowan Sports Center into this joint user complex. Thank you.
谢谢。
Any follow-up from Dr. Tan? My first question about district health center versus community health center. I know these are two different institutions. They serve different purposes. But people may mix up one for the other. Why not put the two health centers on the same floor instead of putting them so many floors apart? So I think we got your point. So anything from you, Mr. Gary Poon? I want to invite my colleague from the Health Bureau to tell us more about that. So who will take the question, please? Dr. Chen or Mr. Calvin Low? Dr. Ian Chen. The District Health Center will be under the Primary Healthcare Commission. Anyone can access the service there. It will be a co-payment model for some services. Now for the community health center, it will be under the hospital authority. And this one is for those on a lower income, for seniors, and for the disadvantaged. So these two centers complement each other. There will be no overlapping. That's why each needs its own facility. Next, Mr. Scott Leung. Thank you. I support this joint user complex. That's because the different services to be provided there will meet the needs of the local residents. That explains the urgent need for this complex. Now, I have some questions. These are questions from the discussion at the PWSC. At the future joint user complex, half a floor will be an urban hostel for single persons with 40 spaces. At the PWSC meeting, I said that in Changsha Wan, there's another singleton's hostel at Sunrise House. There are 80 to 90 spaces in Sunrise House. Government finances are strained, so people think the government is cash-strapped, and then they wonder, we still have vacancies elsewhere, why build this new singleton's hostel? The government did explain on different occasions that we're talking about two different kinds of users, one for Sunrise House, another one for this joint user complex. But people wonder why we're not making better use of the vacancies in Sunrise House. So you have 80 to 90 unoccupied spaces. No one's using them. You should be thinking about a way to serve more people with the vacancies at Sunrise House. That's how you make better use of resources. That's how the community can see why you decide to put a singleton's hostel in the future joint user complex. So before we complete this user complex, can we have a mechanism for the service users at Sunrise House? We had urgent cases, people with urgent needs, and there was nowhere to accommodate them. We want to avoid that. Now, in the past, government officers were situated in different areas. Now, this future user complex will house the officers from the departments in Changsha Wan, and that will free up community centers. Can we put new services in those old spots instead of leaving the sites idle? We had different discussions in the past. Local districts are short of service centers for ethnic minorities. Can we put new services such as those for ethnic minorities in the old spot so that we don't just let a site lie idle? Mr. Gary Poon, please. On the point about Sunrise House and the urban hostel for single persons, I want to thank Mr. Scott Leung for reminding us about that issue. So we talked to the departments in charge of those two kinds of facilities. Both kinds of facilities are urban hostels for single persons, but they have different service users. Take Sunrise House. All the rooms there are single rooms without windows. That's to meet the needs of the users. The Salvation Army runs Sunrise House on a self-financing basis. Now, for the Social Welfare Department's hostel to be provided in the future joint user complex, the service users are more like displaced persons. So there will also be support services and counseling from the Social Welfare Department. So we will be having rooms for 4 to 6 people instead. So we thought about converting single rooms into larger rooms for 4 to 6. Doing this would involve extra costs. Taking this approach would also affect the services at Sunrise House. So in terms of the hardware, this may not be the best approach. Indeed, as Mr. Scotland said, the occupancy rate is 70 to 80% at Sunrise House. There are free spots. From what we have learned, when referral cases are needed on compassionate grounds from the Social Welfare Department, the places at Sunrise House are used. So it's not like the Social Welfare Department and the Salvation Army each works in their own silo. Every month, the public can also visit the facilities at Sunrise House. So that's the point for Sunrise House. We will also pass on the observations from Mr. Scotland to the Home Affairs Department. Now, about the offices. We build the new complex and then we will free up the spot at the old building. We would use the space as soon as we can. Now, this complex will take 4 years to build. Now, you have the Nam Chung Community Center. So the HAD will look for suitable services to put in the old buildings. So that's my response. Mr. Chen Siu-hong. Thank you, Chairman. This joint user complex will be entrusted to the Urban Renewal Authority for design and construction. The URA will do the preliminary design, administration, and supervision, and that's why the government will pay $270 million to the URA, and that's 9.6% of the total project cost. I raised this matter at the PWSC meeting. Yesterday, I got a reply from the government. So I got a breakdown. Design 3.2%, and then work supervision and contract administration making up the rest. Here's my question. So we're paying the amount. The URA takes that money and acts as a gatekeeper to keep an eye on the quality and progress of work. The URA also keeps an eye on the cost. So my question is, so what are the respective roles of the Development Bureau and the URA? Say you have a cost blowout and delay. Will the URA be held responsible? My next question has to do with my first one. We're paying more than $200 million in on-cost. Will that be an accountable basis if there's a cost blowout? Will that also mean a higher on-cost? Thank you. Mr. Gary Poon. I thank Mr. Chen for his questions. Our project cost in the paper is based on the returned tender price. As Mr. Chen has said, the URA takes an active part in the project. There will be more work for the URA in project management and supervision. In a moment, the URA can tell us more about how they split up the work with the Development Bureau. The URA has already done the tendering. They have vetted the tenders and then arrived at the project cost. So some of the work has been done by the URA. More work lies ahead for the URA. From what I've understand from Mr. Chen's concerns, what happens if there's a cost blowout? We're not too worried about this. The cost now is based on the returned tender price. In the absence of a major change to the design, this cost will remain the case. So we don't see a chance where we will see huge cost variation now. Is it Mr. Yu or Mr. Tam who will tell us about the cost? Mr. Matthew Yu from the ASD. Now for this project, the Architectural Services Department will be the controlling officer. We will keep an eye on the reports to be submitted by the URA during the works. So those reports will cover the progress, the costs, and the quality. We will work closely with the URA. There will be monthly meetings. If needed, we will do site visits to check on the progress. So there will be oversight over the quality and progress. So that's the role of the ASD in this project. Mr. Gary Poon and Mr. Matthew Yut, one part of Mr. Chen's questions went unanswered. We were told it's unlikely there will be a cost blowout, but when that happens, will the URA be held responsible? And is this on cost on an accountable basis? Can you get to the point in answering the questions? Chairman, you made a good point. I was very specific with my questions. I wasn't asking whether they were confident about there would be no cost blowout. My questions are about whether the URA will be accountable after taking the money. So we know a third of the money is for the design. Now, what if there is lax oversight? If that's the case, will the URA be held accountable? And also for the cost blowout and overrun, and will the cost be an accountable basis? If the works go smoothly, the cost may end up being lower than $200 million. So, is the cost on an accountable basis? Is that written into the contract? Who will take the question, please? Mr. Gary Poon. So we have a rough estimate of the project. So we looked at the work involved, how much that will cost. That's the basis for us to arrive at a figure for members' reference, and that's the figure you see in the paper. Mr. Chen asked specific questions. Is that cost on an accountable basis? So we followed the contract. We want to give the URA a rough idea the budget they have. As I said, we do not anticipate a cost blowout, and if that happens, we follow the contract in dealing with the matter. The speaker is not speaking into the microphone. Mr. Chen's question is, will the URA be held contractually liable for any cost blowout? Mr. Matthew Yut, it depends on the circumstances. We look at the project, we look at the final cost, and then we can decide. there may be geotechnical issues during the works, and those may be cause majeure or force majeure. So we will look at the situations on a case-by-case basis. Extra costs may be incurred, and if that's simply force majeure, we will look at the situation, and if that makes sense, we pay the contractor for that. The on-cost is a percentage of the project cost, in this case 9.6%, so we pay 9.6% in entrustment cost to the URA. That's the general practice. And then there may be works variations. The project will take years to build. So there will be regular monitoring, and requirements may be varied, and this will be dealt within the contract. So the cost may change. So it all depends on the actual situation. Some factors may be beyond the contractor's control, so we really have to look at it on a case-by-case basis. Matthew, I think your point is that it's not written in the contract, it depends. Is that what you're trying to say? If you have nothing to add, I will take it that's what you mean, so it's all recorded.
Chair, I'll perhaps ask my other questions in the second round. Thank you. Mr. Vincent Ching. I support this project because it will support the continuous needs of Shamshui-Po district residents for recreational facilities, social welfare, and healthcare facilities as well. I believe we have raised different issues at the Public Works Subcommittee meeting, just as Mr. Leung mentioned. I think we should make sure there is no overlapping of functions in the facilities the joint user complex has and other facilities in the vicinity. And we also talked about how we would have some services from the Nam Trang Community Center relocated, and I don't think there is any concrete plan at the moment. We had some suggestions before that we would have some service units be made available, such as some EM centers, but there has not been any update since the Public Works Subcommittee meeting. We also talked about the provision of parking spaces in the joint user complex, and it seems that there are not enough parking spaces for PWDs because there are only 3. As we have the social welfare facilities and facilities for persons with disabilities there, why not put more of such parking spaces in the joint user complex? 2 questions. Mr. Gary Poon. Thank you. For the parking spaces designated for persons with disabilities, we actually derived the number of spaces based on the number of people we expect will be using the facilities in the joint user complex. We will have an officer that can provide more details on the parking space estimate. But as we said before at the Public Works Committee meeting, if a person with disabilities or their carers have such needs, they can work with the property management office of the complex to provide additional support to them. And we can arrange for them to use the parking spaces for service organizations if necessary. We are putting the joint user complex here because it is in a very convenient location. It is located close to Lychee Kok Station, Changsha Wan Station. There are also many bus stops along Changsha Wan Road. So it is quite a convenient location for users. But if they want to drive here, we do have parking spaces available still in the complex. The other question was about relocating other services here, or the vacated premises. What will be provided there? We have the office of the different departments in Changsha Wan Community Center, Changsha Wan Integrated Family Service Unit, and the Lychee Kok Social Security Office, and the Shamshui District Welfare Office from Nam Trang Community Center that will be relocated to this joint user complex. We will convey your views to the relevant departments to make sure the departments make good use of the space available. We have a consensus here. We do want to make good use of the space. Otherwise, there's no point to reprovisioning the services here. So we will pass on your views to the relevant departments, and if we hear community feedback on such, we will refer to the specific departments as well, such as those relating to Nam Trang Community Center. We will refer the views to the Home Affairs Department. Yes. We actually have the 3 parking spaces for persons with disabilities. We have also 6 to 7 parking spaces for coaches or medium-sized shuttle buses. If those spaces are not occupied, we are more than willing to let those who need parking spaces make use of such for their visits to the facilities in the joint user complex. We can also arrange for support to be provided in relation to temporary parking if one wants to convey their family members to the relevant facilities in the complex. I also want to provide more information to Mr. Lerman Kwong's questions from earlier about the net operating floor area. It is approximately 4,700 square meters, 40,000 odd square feet. So for the different fitting out works, E&M works, we believe the cost is adequate for this area. Thank you. Mr. Chen Yong, I recognize there is a need for the works to be undertaken, and you have decreased the cost, the estimated cost, from $2.918 billion to $2.891 billion. This is something good that you're doing. I have a question, however. So I do see the artist's impression. The design looks quite nice. I'm not sure how much actually factors into the design in terms of cost. If we adopt a fitness for purpose and no frills design, can we further compress the cost? If we do that for other projects as well, it will be a good way that we can save costs. Now, for the urban hostel for single persons, if they do not need particular care, can't you refer them to just transitional housing or light public housing? I think there are other services that they can make use of that are probably less costly to provide. But let me also declare that the charitable organization I serve is working on some transitional housing project. But all I'm saying is that perhaps we can vacate the space for better uses. I also want to ask about parking spaces. So we have seen in another project it would cost much. If we can save more costs for more uses that are more suitable for the community or more needed by the community, I think it would be better. Thank you. Mr. Gary Poon, we all along adopt the principle of fitness for purpose and no frills. We also incorporate some latest concepts in the design of the joint user complex. I'll let the URA representative elaborate on that later. We not only want to provide facilities for the district, we also want to reinvigorate the space. I will let the URA representative answer the question about the cost, and then I'll let the RHSD representative answer the other questions. Well, there is other question for the urban hostels for single persons. Well, I can respond to that now. For the joint user complex, what is the mix of facilities that we are providing? You have to consider that. We are providing hostel spaces for mentally handicapped persons. We also provide spaces in the urban hostel for single persons. We have in mind the demand in the district when we allocate space for the facilities. We do understand that there may be changes in circumstances. The Social Welfare Department in their operation will consider what the latest situation is. Who is going to answer the question on cost? The URA representative. Mr. Leung. The design cost takes up approximately 3 to 4% of the total construction cost. This is what is estimated in the tender bid. But the design is, of course, fitness for purpose and no frills. The member said in the artist's impression that the external wall looks beautiful. It is quite colorful. But then most of the wall is actually bricks. Some of it is painted. We do have some facades. We also have some decorations, but there's not much of that. All right, the question on parking spaces. Mr. Matthew Yu. Thank you. For the unit cost of parking spaces for this project. For this project in particular, the parking spaces are underground. The cost is approximately, in September 2024 prices, $20,400 in construction costs. So this is comparable to similar projects, approximately $20,000 odd per square meter. Dr. Chen Han Pan. Thank you, Chair. I support this proposal. We are actually very jealous because in Kuaiting District we have been longing for a joint user complex, to have such a complex that will provide different facilities for citizens. But we have not seen that materialized in the Kuaiting District. I am very jealous. We hope in future the government will construct one in Kuaiting. Going back to this project, I can see that this is indeed a joint user complex. There are different facilities available here for the elderly, for the mentally handicapped persons. We have also clinics here. I can see that you said in your paper there are different facilities available, such as the high efficiency chiller and the ventilation facilities. But then we have quite different facilities here. They need to have different ventilation systems, I imagine. So if you use a single system for all the facilities, wouldn't that be inefficient? Because it can be quite costly. Say clinics are not open at night, but then we also have some hostels that would provide accommodation for people overnight. So with the allocation of ventilation, can you actually separate the facilities? How can you try to save costs if you use a single system? Second, about paragraph 24, item J, for furniture and equipment, it costs over $100 million. But for the district health center, they are going to do their own fitting out works. So when you said here for the furniture and equipment over $1 million, that would involve, say, the dispensing stations. I would want to know if these comply with Department of Health standards. If you are no longer using them there, can you have the Department of Health use them? How will you allocate the furniture and equipment to make sure the use of such equipment is appropriate? My third question is about parking spaces. There are only 60 parking spaces in the complex. I am concerned because you have a sports ground nearby. Whenever there are activities held in the sports ground, the parking spaces there may be fully occupied, and we do not have enough parking spaces here. So can the government make sure the sports ground can provide accommodation if necessary, have more parking spaces there, or make use of an automated parking system there so that we have enough parking spaces for the area? Thank you.
多謝議員嘅提問。
3 questions. Thank you. I will take the question about parking spaces first, and then in a moment, the Health Bureau will tell us about the healthcare facilities and the thinking behind the design. There was a question about ventilation. For that question, the URA can tell us about that. Now, the parking spaces. So we have looked at the number of parking spaces that the complex can accommodate. And we have also looked at the needs of possible users and staff members. 60 parking spaces are a reasonable estimate. As the SWD has told us, those spaces cover those for persons with disabilities and rehab buses. Around the complex, there are quite a number of public parking spaces, so we're not too worried about this shortage of parking spaces for users. At the panel discussion, we also made this point. Once the complex opens, we will keep an eye on the traveling patterns of the users. We will look at whether we can put extra parking spaces around the complex, but that will inevitably take up space that could otherwise be used by LCSD facilities. For now, we think the parking spaces will be enough, but we will keep an eye on any change to the commuting patterns of people once the complex opens. Now over to Mr. Calvin Low from the Hospital Authority. Now on this list, any furniture will be subject to further tendering by the hospital authority, so the furniture we get will be fit for purpose. Now over to the URA. A brief response on the ventilation system and air conditioning. Can we switch on the microphone for Mr. Leung, please? Thank you, Chairman. on ventilation and air conditioning. So for the hostels, the air conditioners can be switched on when they are needed. For other parts of the building, we will have central air conditioning. This will save costs, and this will also mean faster construction. So you will have different air conditioning systems for different parts of the building. So you can have just a few conditioners on at a time. So there will be separate air conditioning systems. Now over to Mr. Chen Kim-po. I declare an interest. I'm a director of the URA. I have a similar question to Mr. Chen Xiu-hong. I'm looking at the paper. I'm looking at the breakdown. The on-cost going to the URA is $200 million. That's for the preliminary design and administration as well as project administration. So what's the benefit of entrusting the project to the URA vis-a-vis getting a contractor to do it instead? Is the URA charging the market rate? If the URA is charging too much, then the government is being shortchanged. But if the URA is charging too little, then the URA is getting a raw deal. So those are my two questions. So for the role of the URA in this project, first, I want to tell you why we are entrusting the project to the URA. So here's the context. Around Chengsha Wan Road, there are redevelopment projects under the URA. Take Kim Sheng Lei and Fuqua Street. That project is going on. The site of the Chengsha Wan Sports Center will also be developed. So in this area, you already have URA project, and there's also a need to reprovision the sports facilities. That's why we have picked this spot on Chengsha Wan Road for the joint user complex. Several projects here have to do with the URA. That's why we're entrusting this project to the URA. So there will be better coordination, and that will mean lower costs. That's our goal. Now, on the project cost, if it's done by the URA vis-a-vis if it's done by a contractor, Mr. Matthew Yu will take the question. Now, this on cost, this will be 9.6% of the overall project cost. So we have added together several items, and that's how we arrived at the sum. So we covered this matter at the PWSC meeting. We held a further meeting to discuss the matter. So there are two kinds of cost. One, design and planning, that's 3.2%. Preliminary tasks have to be completed before the project, so that involves site investigation and commissioning a consultant to do traffic impact or environmental impact assessments. And then during the works, work supervision and contract administration will be involved, and these subsequent tasks make up the remaining 6.4% of the on-cost. So you have 3.2% plus 6.4%, altogether 9.6% of the project cost. Now for the 6.4%, we'll have to get a contractor to put resident site staff on the site to keep an eye on the project progress, and then we also have to pay the URA for the wages of its staff members for the work. We arrived at 9.6%, based on the individual items needed. We look at each task, each service required from the URA. So they fall broadly into two categories: planning and design, 3.2%, and then work supervision and contract administration, 6.4%. That's how we get to 9.6%. Deputy Secretary. Just then, the AST gave us some details. For the on-cost, the Project Strategy and Governance Office under the Development Bureau has also looked at the on-cost, and their conclusion is that this cost makes sense. Mr. Chan Kin-po's question was whether you compared this cost with what it would cost had an outside contractor done the job. So have you done the comparison? So I can confirm that the sum is comparable to that if it were done by a contractor, and we arrived at the conclusion that it's a sensible level. Next, Mr. Chen Hoyan. So I support the single-site multiple-use approach. But you're putting everything together: recreational use, healthcare, and childcare, elderly care. You will have to put a lot of thought into the design. So I want to start with the question on the lift. So there will be 3 lift lobbies. Top of mind for me is that there are many wheelchair-bound people in the area, and then on the 2nd, 3rd, and 4th floors, you have facilities for persons with disabilities and persons with mental handicap. So you will have a lot of wheelchair users using the lift. Let's look at the layout plan on the right. Lift going to the 2nd to 6th floors. You have 1 accessible lift and 3 yellow lift. My question is, what's the difference between the accessible lift from the regular yellow lift? Do you have buttons that are lower in your barrier-free lift? Some wheelchair users struggle to lift their hand to press the button. We're putting $2.8 billion into the project. Do we have specially designed lifts for wheelchair users? Now let's come to the 1st floor. Rather going to the sports facilities, you go to the lift on the left, and then on the ground floor you have just the blue lift, and then 1st floor just a blue lift and the yellow lift. I'm looking at the floor plan for the 1st floor. So for people going to the sports facility, they have to go to the childcare center on the 1st floor. Otherwise, they end up with just 1 barrier-free or accessible lift. So why this design? We heard that 60 parking spaces would be enough, and there are other parking spaces nearby. I have an office there. In Lai Chi Kok, there are many industrial buildings. We never felt there was a glut of parking spaces. Police officers issue tickets for illegal parking all the time. For the 60 parking spaces, government vehicles and outside users will use those spaces. And then let's bear in mind, carers of children will also use the parking spaces. How many loading and unloading or pickup drop-off points will there be? The people requiring care may also access transport services. We're spending $2.8 billion. Can we really help the people who will be using the building? So those are the questions for the Deputy Secretary. So there was a question about accessible lift. Mr. Leung from the URA will take that question. I thank Ms. Chen for her questions. There will be an accessible lift. The buttons will be easier to reach. There will be 3 lift shafts. Each lift shaft comes with an accessible lift. So we provide those lifts based on departmental needs. What about the question about the recreational facilities? So people will have to go to a different floor for the lift to the sports facilities. So there's a lift lobby on the ground floor. The design will make it easier for wheelchair users to use the lift. They can go straight to the destination. What about parking spaces? So this joint user complex is well served by public transport. And as I said, after the panel meeting, we looked at the parking spaces again. Let's look at the Shamshabo Sports Center next to the future complex, and then in the area around the complex, there are more than 100 parking spaces that will be available to the public. We expect most of our users to take public transport. Now for the 60 ancillary parking spaces, there are site constraints. Below the site, the basement will be very close to the MTR's utilities tunnel, so you cannot go too deep. And we also have to make allowances for the social welfare facilities, and they cannot go beyond a certain height. 3 out of the 60 parking spaces will be for persons with disabilities. And the future property management can also give the parking spaces to people with such needs. Close to a third of the floor space will be for social welfare purposes. We'll try to make it easier to use for persons with disabilities and their use and the carers.
Actually, Ms. Chen asked this question that is already asked before. I don't think they can provide additional answers. Well, I think they did misunderstood my question about lift. You said there are 3 accessible lifts, but only 1 accessible lift can go there. You have other lifts that can go straight to 13th floor or above. So I think for the severely mentally handicapped persons, they are often wheelchair bound. Some elderly persons are also wheelchair bound, but you only have 1 accessible lift for them. That's the problem. Mr. Leung. Mr. Anderson Leung. We have a lift that serves the social welfare department floors in particular, and we had already communicated with the social welfare department on this. We actually drew this as requested by the social welfare department, but I do note the members' concern. We will communicate with the department to see if we need to have more lifts or whether we can convert the existing ordinary lift into another accessible lift. Thank you. Next, Mr. Eric Yim. Thank you. Chair, right now the real estate market in Hong Kong is not doing so well, especially the commercial property market. We have many vacant industrial and commercial premises. So I think the government needs to think about maybe there are alternatives here. First of all, whether this joint user complex has to be 70-story high. We talked about here being 1/3 of the space being social welfare and recreational facilities and healthcare facilities. Can we rent 5 to 6 stories of a commercial building and convert it to, say, recreational facilities? That would save costs and you can support the local real estate market. If you can do this, you should be able to save costs, and that would already compensate for the costs you need for renting the premises or buying the premises in the first place. So have you considered this? If you think in the end reprovisioning the facilities in the joint user complex is the best option, I want to ask, for the 5-a-side football pitch, you would have to accommodate 400 spectators. We do have people playing soccer there, but I don't think every day we would have 400 people watching people play football there. I'm guessing at most once per month. And if people want to have bigger football matches, I think they would rather rent, say, school premises for that. So have you considered whether there is indeed such need to accommodate 400 spectators in the facility? Thank you. 2 questions, Mr. Gary Poon. Thank you for your questions, member. We do try to make good use of the space, and I believe that is where the member is coming from. We are adopting a single-site multiple uses approach. This is exactly how we can make good use of space to limit the floor area of facilities in a way. And this joint user complex is 17 stories high. We have many industrial multi-story buildings nearby. This height of 17 stories high is actually comparable to other buildings in the area. We hope that with the current parameters, they are able to provide suitable services for citizens. As for whether we can rent existing office space or commercial space for recreational facilities. Now, one of the facilities to be proficient is the old Changshawan Sports Center. Many of the facilities in the center do not comply with the latest standards. The existing Changshawan Sports Center is to be redeveloped. How will we deal with that is for the future, but there is a need to reprovision the center. We will have better equipment and facilities upon reprovisioning. As for whether the 400 spectator stand is necessary, according to the latest standards, we will have 2 basketball courts in a sports center, and at most you would have 4 teams playing in the courts. So when you think about it, if we have sports enthusiasts, cheerleaders, or say if the teams are from schools, we will have parents, teachers, cheerleaders there. We believe 400 is not exactly many, so we consider this figure to be reasonable. All right, next, Dr. So Chen-Wing. I support this proposal. This proposal makes use of a single-site multiple uses model. It makes good use of the space there, and it is also a good use of the resources to provide facilities for citizens. In the 2021 policy address, there are calls for a Shamshui Post study, and the study was undertaken in 2022 with the reallocation of land uses and renewed planning. We then have this urban renewal blueprint for the area. I'm not sure if this project is actually stated in the blueprint, or even if it is in the blueprint, whether it follows what is stated in the blueprint. We talked about the study, and the study is about being planning oriented, improving the environment of the area, and having a reasonable allocation of resources so that there is no overlapping in functions and that there can be a synergy effect of the facilities provided. Another member asked about the 400-seat spectator stand for the sports facilities and the allocation of facilities. There are reservations about overlapping of functions of facilities in the area. Now, this study covers 130 hectares and 1,800 odd private buildings. I think the study has rich data to justify planning and what a reasonable allocation is. So I want to ask what your basis of allocation is. I think this is a policy-related question. So I only need a brief response from Mr. Gary Poon. It has nothing to do with the issues that we are supposed to consider today. Mr. Gary Poon, thank you. I'll give a brief response. The joint user complex ties in with other redevelopment projects in the area of the URA, such as the Kim Shin Lane Fuqua Street development project. There is a need for comprehensive renewal of the district. It is also necessary to provision the existing Chen Shaowan Sports Center because it was first established in the 1970s. It has been some 50 years. And this is why we're making use of this opportunity to provision other facilities and this existing Chen Shaowan Sports Center. The Shenmong study is ongoing. It has nothing to do with the project we have here, but I think with different studies or planning in general, the existing and planned facilities will be considered. I believe there will not be any overlapping of functions of facilities. Please rest assured. We have 3 members speaking for the first time, and we have a member wanting to speak for the second round. If you wish to speak, please come to the conference room as soon as possible to press the request to speak button. Otherwise, we'll put to vote the item after all members have spoken. Mr. Lee Chen Kang, I want to first ask whether there are accessible access to the sports ground, because we may have those having made use of the sports ground facilities going to the joint user complex for their changing facilities or shower facilities. I also have another question that another member asked earlier. I do note that you have 3 different zones, essentially 3 different lift lobbies. Have you studied what the use patterns of the lifts are? What are the hours that people tend to frequent certain facilities? is it possible that there may be better sharing of lift facilities at certain times? But I also note that, say, for the hospital authority lift, the LCSD lift, and the social welfare lift, there will be in 3 different sides. But then you only have one lift for the conveyance of goods. So more likely than not, we will have some of the goods that may be unclean or unhygienic from the healthcare facilities that may be exposed to frail users of other social welfare facilities. Will you make sure there is disinfection done to prevent cross-infection? You're going to spend $800 million for E&M facilities. I hope that you're making good use of the resources. So I also want to ask, you are spending $188,000 for recurrent expenditure. How is it allocated to different departments? Thank you. 3 questions.
提問關
Thank you. I thank Mr. Michael Lee for his questions. First, accessibility. So next to the complex, there is the Shamshui Sports Center. People go jogging there. I do that too. So there are changing rooms, and there are shower facilities. So I think people going to the sports center will use the facilities within the same center. Now on accessibility, the last thing we want to see is the future complex affecting the access to the center. On 3 sides of the current sports center, they have roads. The only other side that is not a road is the future joint user complex. Of course, we will leave space for pickup and drop off as well as loading and unloading. We also want to leave some space for pedestrians to access the sports center after the complex opens. Now, on the layout of the lift, Mr. Leung can tell us more about that. Mr. Leung. Thank you. Mr. Michael Lee raised a concern about cross-infection. We have heard such concerns from departments as well. That's why we have 3 groups of lifts. So you have the lift for the LCSD, that's for people going there for the sports facilities. And then for the social welfare department's lift, those lifts are for people with disabilities or mental handicaps. And then for the hospital authorities facilities, there will be a separate group of lift. So they have a separate lift. Departments are aware of such needs. That's why you have 3 lifts for separate management. But what about the sharing of lifts during busy hours? Can that be done? You have 3 separate sets of lifts after all. Different departments have their own requirements about the lift. So there will be enough lift surface during the busy hours. When you have many people going to an event of the LCSD, you may have hundreds of people going there. That will cause a bit of problems. But that won't happen often. So in those cases, we may open up the cargo lift to the public. So overall, there should be enough lift surface. So how do you spend the $180 million per year? Now I want to discuss the lift as well. So I want to tell you about the idea. So we have told you the concept. But in terms of the practice, I think it will be similar to our idea at this point. On the sharing of lifts during busy hours, so we will consider Mr. Lee's suggestion. Now, on the annual recurrent expenditure, which is expected to be $190 million a year, $150 million will be for the SWD. For the LCSD, that's roughly $40 million. Now, for the SWD, there will be care homes. The SWD will have to hire more social workers and staff workers. So that's the breakdown at this point. Mr. Carmen Khan. This joint user complex will improve people's well-being, so I support the project. For us at the Finance Committee, we keep an eye on the money. Mr. Chen Xiu-hong raised this question as well, and we got a reply yesterday. So we have the 9.6%. 3.2% goes into planning and design, 6.4% goes into works management and contract administration. So the URA will be monitoring the performance of the consultant and also keeping an eye on the work's progress and quality. So I'm looking for a straight answer. You have the Development Bureau, you also have the Financial Services and the Treasury Bureau. And then you're also getting the URA to keep an eye on the works. So how can we tell this arrangement is warranted and justified? Is the URA covered by the Audit Commission if there is a cost blowout and overrun? The URA is beyond the scope of the Audit Commission's work. So in that case, would that mean only the Development Bureau and the FSTB will be covered? Or will the URA be held accountable for any cost blowouts and overruns? Deputy Secretary, this is a public works project. That's why we're seeking funding approval through LegCo. After the funding phase, any mechanism about oversight applicable to works projects will also apply to this project as well. Now, more on oversight. The Works branch of the Development Bureau has looked at the project cost. They are professionals, and they're working with the ASD on the cost estimate. And since this is a public works project, the Architectural Services Department will also monitor the project. And then we're entrusting the project to the URA. That's because during the works, resident site staff are involved. Someone will have to keep an eye on the contractors. Someone will have to make sure the works are up to scratch in terms of the quality. This frontline work will be undertaken by the URA. And this project, since it is also a public works project, will also be supervised by the EST to make sure we spend public money properly. Something has to be sorted out about the oversight. So you entrust the work to the URA, and the URA oversees the work of the contractors. Can we get the FSTP to explain this? Now I'm also looking at Note 2. The URA will also be covering the public open space in the remaining part of Site B. So how will all that oversight work? Mr. Andrew Lai from the FSTB. Now, on project management, as the Development Bureau said, this is a public works project. The Director of Architectural Services is applying to LegCo for the funding of $2.9 billion. The ASD will take up the primary responsibility. So in the past, the ASD served as the project manager of those projects. The ASD would monitor the contractors in the past. But here, urban redevelopment is involved, so the URA takes part in the project. So in this case, the project manager is the URA, but the URA will be reporting the progress to the ASD. Deputy Secretary. Ms. Carmen Khan also asked about Note 2. There are two parts to Site B. Part 1 to the east is a construction site. It's already freed up. This part will become an open space because the other part to the west, the part earmarked for the joint user complex, it's currently a park. The park will become the user complex. But building the complex will mean taking away the park. That's why we want to turn what is now a construction site into an open space instead. So this funding proposal only covers the joint user complex. The open space will be dealt with by the URA with its own money. My question is, so you will have separate accounts, is that the case? So he has explained this clearly. That open space is outside the scope of this project, so the URA will be managing the open space project. So we're simply asking for funding for the joint user complex, only for the complex. This is the part requiring government funding. And then gonna confirm whether the URA is covered by the Audit Commission. The Permanent Secretary said the ASD will be responsible. So if an audit comes along, the Audit Commission will go to the ASD. Is this correct? Yes. So for this public works project, if questions are raised as to the works and cost, then the Director of Architectural Services will have to explain the matter. On whether the URA is covered by the Audit Commission, I guess no, but I will need someone from the URA to confirm this, Mr. Leung. I believe the URA is not covered by the Audit Commission. I'm not familiar with this space, but please give us the information after the meeting. So find out and then come back to us on that. Reverend Peter Kuhn. Top of mind for everyone is possible cost blowout. The government mentioned force majeure and many other things. That I was lost. For my church, it's building a kindergarten. We're trying to stay within the budget, otherwise it will be a disaster. So my question is, we have seen cost blowouts in the past. When the government gets a cost blowout, it comes to us for more money. But our question is, how do you exercise greater oversight to stay within the budget. I would like a response on this. Now, on the basement, from what I've learned, the chief executive is trying to move the structures onto the upper stories. And then because we will put welfare facilities there, we have to be mindful of the height restrictions. There will be child care centers, there will be elderly care facilities. This complex is not exactly within residential areas. Now, since property prices are falling, can we build an extra floor and use that as the car park? That will mean you can build it faster and you can lower your operational cost. It's $70 million. And then you have to consider the foundation, it will be another $100 million. So you can achieve savings of over $100 million. So removing the basement will make it easier to manage. 2 questions for the Deputy Secretary.
我諗
Mr. Gary Poon, thank you. For the cost of the Public Works project, the cost reflects the return tender prices. So it should reflect quite accurately for the different components what the costs are. Now, how are we going to monitor the implementation? The URA in future, once they have engaged the contractors, how we can make sure the money is spent wisely? I will ask Mr. Leung from the URA and the RHSC representative speak on this later. All right, Mr. Anderson Leung. As Gary said, this project's cost in the paper already reflects the return tender prices. We have also incorporated all the requirements of departments in the proposal, so the costs should be quite accurate. Should there be changes, the changes would have to be pre-approved. This is how we can practice stringent cost control. Every month we will report to the Architectural Services Department how much we've spent, what we've spent on. This is a second level safeguard. And if there are some substantial variations, then that would be something that we actually have to spend on. Yes, Mr. Yut. Thank you. As said by another officer, the cost reflects the return tender prices. Should there be any changes in the project cost, we do not expect it to be significant. But we shall meet with departments to see if there are any variation of orders needed, or whether the intended uses are really appropriate. In turn, if changes are needed, there may be variations of order. And the RHSD will meet with the URA to make sure the variations are justified. And we will have monthly meetings, so this is how we can practice cost control. Can you make adjustments to the basement works? How can you save costs? What are you going to say on this? Mr. Gary Poon, for this 17-story high building, which includes a basement floor, we have been targeting those in Shui-Po as the potential user group. We will provide recreational, healthcare, and social welfare facilities here. We have on the top, the higher floors, recreational facilities, because we imagine most of them should be able-bodied. We have in the middle some healthcare facilities. The lower floors will have the social welfare facilities. It is, as Reverend Peter Kuhn said, there is a height restriction for where the social welfare facilities are placed. This design has already maximized use of the space, which is why we have to put the parking spaces on the basement floor. If we have to put the basement facilities above ground, it may encroach on the existing social welfare facilities. There may not be as much space for social welfare facilities. Another member also talked about accessibility, and it is exactly why we want to maintain some accessibility here for the facilities. We have two other members who would like to speak. Any other members who would like to speak? If not, we will put the item to vote after the two members have spoken. Mr. Yin Kong. I support the construction of the joint user complex in Shamshui Po. I have a question. Now, for this joint user complex, it houses recreational, healthcare, and social welfare facilities. And according to your plans or your paper, there are no commercial facilities, restaurants, shops, or otherwise in the joint user complex. But then I want to ask, when you designed this joint user complex, have you considered incorporating the latest principles of architecture in different places? In government buildings elsewhere, they have commercial facilities to create another source of revenue in terms of rent. It also provides vitality to the complex because it would be a gathering spot. It would be a gathering spot for citizens. So why have you not considered this? Mr. Gary Poon, we are using this space to provide facilities for citizens. We may provide vending machines or light refreshment facilities in the complex in future, but this will only be determined when the joint user complex nears construction. But then you have to understand, in the area there are more than enough F&B facilities. So you have not considered incorporating commercial facilities in the design because there are adequate F&B outlets nearby. As I said earlier, we try to maximize the space providing facilities for citizens. If we have commercial facilities here, it may encroach on space that we had in mind for public facilities. We did consider providing commercial facilities, but we considered how there are many commercial facilities nearby and it is in a very convenient location. There is no need to provide commercial facilities here. I would say there is a great difference with such facilities being in the complex and outside the complex. And if we have those who are going to wait for services, they would want to stay nearby. So why not provide such facilities in the complex? Please consider this. All right, we have Mr. Chen Su-hong speaking for the second round. Well, they have provided a relatively detailed response, so we have already spent 9 minutes on the discussion of your questions. I'll assign a 4-minute time limit for your second round as a result. Thank you, Chair. We have in the first round the administration addressing questions on supervision, but then it is also said the URA can only get 9.6% of the construction cost. Would the URA think if the project goes over budget, the URA can still get the same percentage in the heightened cost. I hope the administration can discuss with the URA to enhance accountability of the URA and provide a written response to the committee after the meeting, or we can communicate through other channels in future. I also note in enclosure 4, looking from Cheng Xiao Wan, we have this artist's impression. It looks very nice. But then I see many parts there are voids, especially in the top left. I'm not sure what this is for. I am concerned about construction safety. I have said on different occasions the government should take the lead to adopt design for safety. If you have so many voids in your design, with construction and maintenance, you are likely going to need scaffoldings, and then you would have riskier operations, the operations that are undertaken at height. So I want to ask, for the $180 odd million that you have reserved for recurrent expenditure, have you incorporated maintenance cost, the relevant maintenance cost in there, and can you change the design so that you can save on such costs? Thank you, Mr. Gary Poon. I will ask Mr. Anderson Leung to answer the question on design and construction safety. Thank you. Mr. Anderson Leung. Mr. Chen was referring to the structures we call healthy steps. The government has been encouraging people to take the stairs for a light workout. Regarding maintenance safety, or the safety of using the steps or stairs, you can see these as stairs outdoors. The handrails have to be at least 1.1 meters high. The design that we have will be at least 1.2 to 1.3 meters high to ensure safety. Maintenance will only involve some painting and concrete work, or some fitting out of the decorations. There will not be frequent or major maintenance. Major maintenance works would only be done indoors, and we will only need scaffolding works in the indoor area, so it should be quite safe. I want to add something. Mr. Chan asked about the maintenance arrangements. In general, the daily maintenance will be undertaken by the Architectural Services Department in future. For the major maintenance works, it would be another story, but the daily maintenance work would be undertaken by the Architectural Services Department. Mr. Chen Xiu-Hong also talked about how you can talk to the URA. Maybe you can set a cap on the amount for the on-cost or the cost of the URA. You can provide a response to us after this meeting. If there are no other questions, I will put to vote this FCR 2025-2643. Mr. Tony, you would like to declare an interest, right? I would like to declare that I am a non-executive director of the URA. I will not participate in the voting. Yes, Mr. Chen Haofeng, please turn on his microphone. I am also a non-executive director of the URA. Mr. Kwok Wai-Keung, please turn on the microphone for Mr. Kwok Wai-Keung. Excuse me? Yes. Chair, I would like to declare that I am a non-executive director of the URA. I believe all of the non-executive directors of URA who are electrical members who have already declared, and I have a list here. Whether you participate in voting, you can decide on that. I now put FCR 2025-2643 to vote. Members in favor, please raise your hands. Thank you. Members against, please raise your hands. None. I believe all of the members who voted on the item are in favor of the item. We have some who didn't vote on the item. Of course, I declare the item approved. The next meeting of Finance Committee will be held on 12th of September. Meeting adjourned.